evening. Good morning for me. Good evening for my co-host and my guest. I'm so happy to be here every week, every Monday. At some point, we're here on a Monday. We're switching times, trying to reach more listeners and educate more people all over the globe. My name is Dr. Tova Goldstein. This is TMS Roundtable, and I'm just delighted to be here. Hi, Rose.
Hi, Tova. Good morning, Tova. Now, guests, we have a wonderful guest called David Spektor today, and he's from Melbourne, a ISTDP psychologist, and his lovely topic is, what if we were never shushed? Now, shushing can be a lovely, beloved sort of comment to our little ones.
Shush, shush, shush.
But it can also mean that we don't acknowledge and we don't accept the child's anger, their sadness, their grief, and we don't repair the break that we've had with them. Now, David has written a beautiful blog about this, and it will draw attachment theory, it will draw trauma theory, it will draw it all together. And I'll just ask him to tell us a little bit about himself and what drew him to this type of work, and also just talk on the subject, if that's all right, David. Thank you.
Yeah, sure. Well, thank you, Rose and Tova, for inviting me. It's an honor to be here and to talk with you and just have this conversation. I'm just looking forward to having a conversation about this.
I'm so excited. I'm going to interrupt you for a minute. I just want to put your website so people can go to your blog. It's
www.psychologycare.com.au.
Yes. Okay. Thank you.
And then you can just click on the blog. But, I want to point out something first before I start. And one is that whilst I'm a clinical psychologist, what I'm saying here are just ideas and thoughts. It's not necessarily the truth. I don't think we know the truth in psychology. So I welcome people to disagree, to have a conversation, to put their points of view, because, we don't know. We don't know what perhaps, I hope we do know one day. And so what I say is just based on my experience and my learning and my readings. But yeah, I wrote, let me tell you a bit about me. I'm British, actually, originally. I was born in London. My parents are South Africans and their parents are Russian. So we are immigrant people. I now live in Australia. I trained as a clinical psychologist in London. I worked in the National Health Service for a number of years in severe and enduring mental health and the public mental health. And then I moved to New Zealand, where I worked at a mental health service for older people for a number of years as the lead psychologist, which I loved. And then I moved to Australia, where again, I worked at a mental health service for older people. And then I left that and went to work at the University of Melbourne, and I'm a senior lecturer there. And also I now own my own private practice called Psychology Care. And I have 12 people who work for me, and I'm just one of those people. I am very interested in emotions and how the impact of not allowing, or the way in which our society reacts to emotion, can cause suffering. And I'm very often have been talking about the medicalization of misery, and how in psychology and psychiatry we have a tendency to diagnose people and medicalize their suffering rather than actually understand the origins of their suffering. And so this blog on what if we were never shushed really follows based on those ideas and concepts and theories, and is really my sort of theory on why we find ourselves, or the world finds itself in this state, and why we have so many people that suffer with struggles in their life. So that's me.
Amazing.
Thank
more,
you.
More.
Yeah, well, okay. Well, I can talk to you about, so what if we were never shushed? There's a bit of a, I understand it's a bit of an outlandish concept in the sense of course, as Rose was saying, when we have a child in our arms, the first thing we want to do when it cries, because we love that child so much, is to soothe it. And that's a wonderful thing. That's something that should never be taken away. And so my concept is, what if we were never shushed, is not at all a talk about or a commentary on that should never happen, but I'm just interested in the language that you use and what is interpreted by us doing that from the youngest age. That instead of us saying things like there, or let it come through, let it come out, we end up actually saying shush. And whilst we don't mean it, what that does is that already from a very, very young age, you're training people that crying, and you have every reason to cry when you're a baby, that you can't communicate, you don't know, you're in this new environment, everything's very scary, you might not get all your needs met, and crying is the only way in which you can communicate. And of course, it's exhausting as a parent, but the language we use from that very early age sets a precedent. It sets the foundation of our personality, sets the foundation of the way we interact with the world and others. And if we're told to shush, even if we don't mean it, the language of shush means be quiet. I'm anxious that you're crying and I need you to stop. And whilst it's not always meant, and sometimes it's not meant at all, it's soothing, sometimes it is meant. I'm definitely a parent and have definitely used it myself. I'm not suggesting I haven't, but I'm talking about what's the impact? And as our children grow older, as we ourselves grow older, not only is our crying shushed, but our anger's overpowered or not allowed. Our guilt is not cherished. Sometimes our love is not reciprocated, or our expression of love is tempered down. Sometimes, sadly for people, sometimes their joy and exuberance needs to be subdued. And we learn as we grow up that our emotions are only acceptable at a certain level. And the problem with that is that the reason why that happens often is because the people around us are anxious about their own emotions. And that when our emotions come up, they get anxious. And in order to calm one's own anxiety, we end up shushing people. Yeah. And I wonder, that there is this theory out there, and I'd love to hear your thoughts on this, Rose and Tova. There's this theory out there that, just like our body heals our wounds, the psyche can heal itself as well. And I don't know what I think about that. It's called the inner healing intelligence, that every human being has this ability to heal themselves. But because we as a society have stepped so far away from what is our inner intelligence, which is our emotions, because if you think about it, emotions are wise, they're intelligent. They come up to tell us something, right? They carry with it this incredible information. And if followed through, then it leads to action.
The emotions come up to tell us something.
Yeah, they're wise. They bring with it intelligence, right? We don't ask for it. We don't ask for emotions permission. It comes up. When somebody hurts us, we feel sad. When we lose something, we feel sad. When somebody hurts us, we feel angry. When we do something wrong and we don't live up to our ideal, we feel guilt. Right? These emotions, they're intelligent. They are wise, and they bring with it, not only do they bring with it a feeling and an action, but a bodily feeling, which then enables us to then jump into action. And that action is often exactly what that emotion is designed to bring to us.
Yes. Now, on top of that, if you think about it, when people with chronic pain have a chronic pain within their body, it's also coming, if you think about it, from that period of time before language, when only their body could speak. And then gradually, as they grow up, they've told their body from day one, it's not okay to speak. So the body then responds by having somatic pain, like having fibromyalgia or something. It's sort of like the body is ready to do something, but it's frozen in that moment. So in this area of being shushed, it's so important to see that the body is actually shushing itself in compliance with maybe an anxious parent or disruption in the family, something like that. So the child then shushes herself or himself to comply, as you said, with the family. But anyone listening to us, if they actually become aware of the mechanism that they've put together at great cost to themselves to shush their own feelings. So that's just to sort of add to the mix so that people can actually see in their own lives what's going on. when they do have somatic
Absolutely.
pain. Yeah.
Absolutely. You know, what happens to all those emotions which are suddenly not allowed, or they bring the person you love anxiety? They end up bringing you anxiety, and you've got to find a way to push those emotions down, because you may not get the reaction you want from the people you love and depend upon to survive. So the thing is, like, how far, you know, when I was talking about inner healing intelligence, you know, I worry about sort of the world as a whole, because I think, how far have we stepped away from allowing our emotions to be our internal compass? You know, that this is what they are. Emotions are our internal compass. And if we don't have that compass, do we then lose the ability to heal ourselves? So, you know, if we could be angry and just it was allowed to come out, if we could be guilty and it was allowed to be repaired, if we could be sad and just allow this sobbing to come through. I mean, how many of us actually, and myself included, can do that? And I think very few. And we live in a society which actually doesn't allow us to have negative emotions.
Well,
so
there's
it's
no
not just
thing as a negative emotion, though, is there?
There's no such thing, exactly. And the fact that we even label it negative and positive tells us already about our society that we live in. You're allowed to have positive, you need to get rid of negative. And this is the problem, because, you know,
David, I'm going to interrupt like an Israeli.
Please do. Please do.
I always learned, and I think it might have been from therapists, I don't know. I just remember growing up and being an adult and thinking emotions are not rational. Now, why am I thinking that? And you're telling me they're intelligent. And I'm like, yay, they are intelligent. Why am I hearing that they're not rational? Can you explain that?
Well, I mean, I think, again, you know, if you have an emotion, we've got to remember, what is the difference between an emotion and a thought? Emotion can't be irrational. Emotion doesn't ask your permission to come up. It just arrives, right? So you need to be connected. Emotions cannot be irrational. Now, that is a really good point that you raised, though, because when I say, like, I've written another blog which talks about emotions are intelligent, and in one of the examples I go, many people reading this must be going, what do you mean? When I get angry, it's completely not intelligent. Sometimes I'll swear, sometimes I'll say things, sometimes I'll do this or that. This is the opposite of intelligent. But emotions are not an action. Emotions are just a signal, right? It's just a signal. And when we get anxious over something like our anger, then we may behave in an irrational way. But actually, when we allow our anger and we don't have anxiety over our anger, we listen to the signal. All the anger's doing, and that's the one that people often talk about when they say rational or irrational. If we listen to that anger, the only thing that anger will tell you to do, if there's no anxiety, is to be assertive. That's it. Just to speak your need.
Yeah.
And this is something we struggle with.
Yeah. Would you actually split now anger and rage for our audience, so that they'll see that it's the rage that's irrational, isn't it? Not the
That's
anger.
right. Exactly. So again, I'd say emotion is anger, right? Rage can be, I mean, it's an argument, rage can be an action, you know. And so discharge, yeah, exactly. Discharge better. It's probably better than rage. So emotion is, again, emotion is just a signal. It's not an action. It's just a signal. It's a signal internally, and this is the intelligent part. It's a signal internally that somebody has disrespected you, invalidated you, unsupported you, neglected you, or abused you in some way. We need that signal. Imagine what it would be like if we walked around this world and we did not have that signal to tell us when we were being disrespected, unsupported, neglected, abused, right, or invalidated. That signal carries with it intelligence, and our ability to listen to that is our ability to stand up for ourselves and ask to be treated differently. Now, what happens usually for all of us is that when we get angry, we notice we get anxious, and some of us may feel like crying even when we feel angry, which is interesting. Others might feel like we lose control. We get so anxious we start to swear, to shout, to raise our voice, to discharge, to do worse things, be violent. That is not anger. That is not anger, that is discharge, as Rose was saying. And that's because we're so anxious over this feeling, based on the fact that our anger at an earlier point would have been shushed. Yes. And so my concept here is, well, what would have happened? What if we lived in a world where our emotions were cherished, nurtured, curated, to a point where all of us, validated, thank you. Where to the point, all of us, where we didn't have to develop these defenses against them, which then lead to symptoms. And those symptoms lead to a collection of symptoms. And those collection of symptoms can then be diagnosed as the disorder, which then is treated as the problem. What happens if we just focused on that earlier point, the thing that originated it all, which is the fact that we need to be much better at allowing from the earliest age our emotions to come through and cherishing them as an intelligence that we hold inside of us almost innately. Like, where did that come from? Where did this thing inside you? It's amazing if you think about it, right?
Yeah.
It's amazing.
Do you think also that we could actually talk about the fact that we create these defenses to block that feeling of anxiety? And then we become argumentative, or we become intellectualizing to block desire.
Right.
Yeah. Can
but I mean, there's so there's so many things that we can do, right? So the thing that we notice happen, because this emotional repression, can we call it suppression, happens at such an early age, we have emotion where we realize that our caregivers don't respond well to that emotion, or they signal in some way that they get anxious about our emotion and they tell us to temper it down. And as a consequence, we learn, because we depend upon them to survive, that we need to change our behavior, because our instinct as a young person is to just attach so we will survive. So we become very good at changing our behavior to suit whatever our caregivers' needs are. And so as a consequence of that, what happens is when emotions come up, because they still come up, we get anxious, which will help us, because if we show those emotions, we might get in trouble. And then we develop ways of not experiencing those emotions, maybe distracting ourselves or pushing them down. And they could be, as Rose said, they could be intellectualization, which is probably a higher order defense. They can be diversification, rationalization. But then, it's interesting, and Rose, maybe you can talk about this too, and Tova, I don't know, but it seems that the earlier the trauma, the more severe, in a way, the defenses that people learn. So if you're traumatized at a young age, or your emotions are really repressed from a young age, maybe you develop things like what people call personality disorders, which I like to refer to as relational issues. And if you are sort of at a later age, you get repression. So now we're talking about depression and these somatic symptoms that you guys talk about. And then even at an older age, we're talking about the more higher order defenses like intellectualization, rationalization, diversification, and things like that. And these are all things that we do in order to escape our emotions, because they make our caregivers anxious.
Yes. Would you also add in catastrophizing?
There's so many things that we could add in, right?
That's right. Yeah. Well, from a chronic pain situation, it's often catastrophizing that creates
the pain,
the chronic pain.
Yeah.
Yes,
yeah, exactly.
Because there's an anticipation that something's going to go wrong. So in anticipation, we'll catastrophize, and then our pain then becomes more acute, and then that loop starts working.
Exactly.
And then the catastrophizing gets worse. So if we think about the fact that instead of actually going back and saying to ourselves, okay, this happened to me then when I was a child or as a teenager, we actually anticipate that it's always going to be the same. And we almost, how would you put it? We almost make it happen for ourselves, don't we, by catastrophizing?
Oh, just explain that to me again, Rose. We almost make what happen?
We almost make it happen by catastrophizing.
Yes, right, exactly. There are so many things that, and I want to be careful here, because I'll say what I'm about to say, but then I'll explain it. And tell me, Rose, and Tova, if you feel it needs clarification. But we as human beings, I find it quite incredible, because when I sit with clients, I am amazed at the ways in which they have spared the people they love from their emotions. Like, I'm amazed. I have so much awe for my patients as I sit there. Like, I sit there and I think, you don't understand how much love you have in you. It's so deep within you that you don't realize how much of a loving person you are, because everything you're doing is in the service of not upsetting the person you love. And John Fredrickson, who I know you've had on your program, he calls it the gift of love. And I absolutely believe in that. And so the reason how I'm answering your question, Rose, is that human beings do amazing things to distract themselves from their emotions. You know, whether that is focusing on body, or in terms of eating, or focusing on rumination in terms of OCD. Or, I suppose, on catastrophizing, as you're saying, you know, what can I do in order to stop myself from focusing on the emotions that are coming up in this moment?
Yes, the anger or the sadness, or even
the
the love.
the guilt, or the love, exactly, or the love.
Yeah, and I mean, the love is so important, as you say, and yet people are afraid to actually show that sense of love, so they also block that down as well, don't they? That it's going to be criticized.
Yeah, exactly. And I, you know, I wanted to be careful saying that, because I believe that people's experience of their pain is absolutely real, you know, and their experience of what's going on in their body, because we can't get away from the fact the mind and the body are connected, right? So, so I just wanted to be very careful when I say distracting themselves. I'm not suggesting that this is something that they're doing.
What the Sarno community and Dr. Schubiner and all the people are saying now is that pain is distracting you from what you're feeling.
Great. Yeah, exactly.
It could be an autoimmune disease. I've taken it that far, and I will stand on that. I will stand on that. And we are meeting people ourselves, and we're seeing that, and they're stuck in a cycle. And they're like, okay, so I know it up here, my pain's distracting me, but then the intellectualizing isn't getting them out of pain. They have to go to that deep, dark place called an emotional awareness that feels like we're estranged from there. I call it like the abyss of the sea, like we're not comfortable there. And maybe after Rose comments, we can talk about how do we get there easily, hand in hand with our therapist, with all the knowledge we have, and heal ourselves.
Yeah. That's it. Rose, were you going to say something?
Yeah, I was just going to add to that thing about being in awe of our patients.
Yeah.
Because they have actually suffered all this situation, many of them for years and years and years, and they've kept going. And that's what's so awesome about it, that they've actually kept going, suffering and all, and they've been there for others. And also there's a part of them that actually is of service or something, isn't there? You know,
say that again. There's a part of them that is
of service to others.
Yeah, great. Yeah. Absolutely. Yeah. I mean, as I said, you know, I love my job because I get to see the beauty of humanity every day. And the sad thing is that I don't think my clients see themselves in that way, of course, because they're in suffering. But actually, what I get to see and be witness to every day is that they are suffering because they spared their loved one from either their amount of sadness, their anger, right, or their guilt even. Oh, actually, all of that is really because of guilt. But all of these things that they spared them, as a consequence of doing that, they then develop this anxiety over their emotions, which then develop their defenses, which then develop their symptoms, which then develop further symptoms, which then developed their collection of symptoms, which then develop their diagnosis.
And then they go to allopathic medicine, which only looks at the symptoms instead of looking at,
And I wonder, it's like we've reduced this incredible thing that I just described to a medical diagnosis. And that's why I say I'm so against the medicalization of misery, because we don't witness the beauty of humanity. We don't get to witness the love that we all have in us, and that all, this pure love that we're just trying to spare the people that we care about. We never get to see that. All we get to hear about is depression or anxiety or OCD or eating disorders or this or that. We actually don't get to hear the story that is incredible behind that.
Well,
and
luckily,
shows again.
luckily, the fact that we're here, sitting here, the three of us, and that Rose and I are coming on a 2-year anniversary of our program.
Congratulations.
I'm saying that because there are people in nooks and crannies, like we have an office here in Tel Aviv called Medical Care, and it's run by an Arab doctor, an incredibly smart Arab doctor. He's not Dr. Nato Bhutta, who's a heart surgeon, and his whole family are involved. Brilliant people, and they run a cancer center with therapists and doctors. And the woman who does the journey work comes to Israel to do her journey work in the center. And I just want to mention, this is what made me think of it. And they call cancer the cry of the soul. This is not like an oogie boogie new age. This is grounded, saying that the body is crying for help. And we're going to answer it in the way that you and Rose are talking about right now. We're going to answer you this way and not that way. And we're going to help you get better.
Our body holds our trauma. Our body holds our trauma. There's an impact. You can't go through trauma without there having an impact on your body. This is something that has been known for probably millennia, I think. That this is something that the indigenous people were very, very aware of in every land. We just have moved further and further away from the fact that our body holds our trauma. And we need to move further to that. But the more we separated mind and body, the further we got away from that. I agree with you, Toga. We're getting back to that. We're getting back to that.
Could we also add to this dialogue the fact that many people can't actually go back there and see the pressure they've put themselves under? And as Tova said, they need to actually see that they're not to blame. But in actual fact, they can only see themselves as blameworthy, can't they? Are you able to draw a little bit more on that?
What do you mean by blameworthy? Just explain that a little bit more, Rose.
Yeah, more that people see that it must be my fault.
Right. Yeah.
This is happening to me, so it must be my fault.
Right. So now we get into a really interesting subject, and that is again, I would say when we go towards this kind of concept of gift of love, and this is the distinction between guilt and shame. And guilt is an unbelievably beautiful emotion. This is the emotion most people don't like. This is the one we're all running from. This is the one that nobody wants to feel. And yet it is your own, and this is what I mean, emotions are intelligent. It's your inner signal of your innate goodness.
Wow.
To feel guilt.
I love that. It's your inner signal of your innate goodness.
Yeah. Right. And this is the intelligence your emotions bring. This is amazing. It's amazing you have the capacity as a human being for guilt. It gives me endless hope for humanity. That we all have the capacity for guilt makes me feel so good to be a human being. Because imagine a world where we were able to feel our guilt instead of shame. And there's a difference between guilt and shame. And this goes to your point, Rose. When we do a bad thing, which all of us do, and we don't live up to our ideal, we can face our guilt, which is painful. And if you listen to your guilt, it does this amazing thing, and it's what we call a corrective emotion. It leads you to repair. If you listen to your guilt and you feel it, it will lead you to repair. However, we've been brought up, and just guilt in itself is an extremely painful experience in the body if you experience it. And maybe I'd ask the people listening, or you yourselves, to think about a moment in your life where you felt guilty, and just try and understand where you feel it in your body. Like, just try and think of that thing that you did where you didn't live up to your ideal, and just think about how you experience that feeling of guilt in your body. And once you understand that guilt and you can feel that guilt, see what your impulse is. And if you're able to do that, you'll note that one or two things happen. One, if you really feel that guilt, it will take you towards repairing, wanting to repair, wanting to reach out, wanting to do something different, wanting to fix. Or we get anxious and we go to shame. And shame is, I can't believe I did such a bad thing. I'm a horrible person. Oh my God, it must be my fault. I'm terrible. I'm awful. And you go to hopelessness, helplessness, despair, and depression. And this is a problem, because that means you're not really in relationship to your guilt. You're in relationship to your shame. And say again?
Well said. Thank you. It's
Right.
really a wonderful way of putting it.
Yeah. And you know, the thing is that when you're in relationship with your shame, you're going to go down to negative thoughts about yourself. But when you're in relationship to your guilt and you listen to it and you feel it and you move through those feelings to get to reparation, you're set free, you're liberated. And so to answer your point, when people go, it's my fault, I'm bad, the thing is that on one level, I think they, and this is where it gets really interesting and a little bit technical, but people can be going to a shame. And I'm not necessarily saying that they should feel guilty, because it really depends on the situation. But people can go to shame and that'll take them to depression. But if, for example, and this is where we get back to the gift of love, when we have feelings towards our caregivers and they haven't allowed us to be the person we want to be, or they just have let us down, if we feel anger towards them, then we generally feel guilty and we shut those feelings down. And we will then not express those feelings that need to be felt towards the people we love, which then can cause the problems we have. But if we had a relationship to our guilt and we could feel our guilt, then we would be able to express ourselves and express our feelings towards the people we love without having to suffer the consequences of pushing our emotions down. But that's getting a bit technical. I'm not sure that makes sense.
Well, it's not really. It goes right back to being shushed.
Yeah, okay. Good. I just wanted to make sure I'm not losing the audience. I'm not sure.
No. It goes straight back to being shushed, doesn't it?
Yeah, exactly.
Well, I want to understand again, maybe if you could simplify the guilt and the shame, because I see it, I never really saw it being similar. It's very similar, shame and guilt.
Yes, exactly. So a lot of people get confused about this. A lot of people get confused about shame and guilt. And you know, I'm not saying there isn't a use for shame. There is probably a use for shame somewhere. But I would say that what we do as a society, you know, like if I just use the example of the law, you know, it's so interesting to me that in our society we have this legal system where people are put in prison, right? And we have a judge, jury, and they decide whether the person is guilty or not. And then we kind of subcontract out our responsibility to feel guilty to this judge and jury, and then we shame the person by putting them in a penitentiary or a prison. But does that person ever get to actually feel guilty for their crime, or does society shame them for their crime? And the reason why I'm using this example is because I think if you're going to really help people correct their behavior, you have to bring them to their own guilt. There's no use of shaming people or shaming yourself, because when you shame yourself, you don't learn. You're not learning anything. If I hurt Rose, if I paid her, if I said something without thinking, if I insulted her in some way, and instead I went to shame, I am not repairing anything. I'm just feeling bad about myself. I'm terrible. How could I do that? That's awful. I can't believe I did that thing. And that's taking me to shame. But if I actually felt my guilt for hurting Rose, if I actually felt my guilt for insulting my friend, and I could feel it in my body, and I could be like, oh, I'm so hurt that I hurt my friend Rose. And then I feel it, and then I act on it. What am I going to do?
You're going to reach out, aren't you?
Right. I'm going to connect with another human being. I'm going to recognize I love Rose. I like Rose. I love Rose. I hurt her. I feel bad. That's incredibly painful. I don't want to experience this, but I'm going to, because I'm a good human being and I fell away from my ideal. And now I'm going to listen to it, and I'm going to
by listening to the guilt, it allows me to move, to do something. Forward. I have an opportunity.
Move forward to another. And by listening to your shame, you're going internal and punishing the self. It's like sometimes you can think of it as I hurt you, so comfort me. That's shame, right?
Yes,
Whereas,
you're right. Say that again, David. Say it again in a different way.
Shame is I hurt you, so comfort me.
I hurt you. Yes, so comfort me. Yes.
Yes.
Whereas guilt is I hurt you, how can I repair?
Yeah.
Wow.
Right? And that's the difference.
Yeah.
And we see this all the time, right, in human beings. We as a society, we don't do, I look at racism, homophobia, sexism, all of the ableism, all of these things. And I look at myself and I say to myself, this is an issue of guilt. And what we need in the world is a guilt revolution. Because you can only hate people who are different if there's an absence of guilt. There is no possible way that we as a society can hate and split if we as human beings orient ourselves back to our guilt. We also would never call people mentally ill or medicalize people's misery if we really came to terms with the way in which human beings treat other human beings, including ourselves, and what we do as a society to cause pain and suffering. We wouldn't have this issue with the environment if we really listened to our guilt about what we're doing to our own planet and the way in which we're setting it up for future generations. If we were able to really orient ourselves back to our guilt, we would be a better community. We would have our better humanity. We would move towards a much more peaceful human existence. And so guilt to me is the critical human emotion that we all need to get better at feeling, and also is the cause of a lot of mental health issues, including, I imagine, chronic pain.
Okay, now let's have a little look at splitting, how we split off guilt, don't we?
Sure. Yeah. Well, yes, exactly. So we hate, right? We can hate, because if we can hate, then we can have those feelings without guilt. And so this is why we split. We split off our love or our mixed feelings, and we go straight to hate. And that means if we, in a place of hate, we don't need to feel guilty. We don't need to feel guilty. We don't need to even feel ashamed. We can just hate. And this is a simplification, and this is what we're doing in our society. Everywhere you look, vaccinated, unvaccinated, Democrats, Republicans, Labours, conservative, liberals, whatever it is. It's like we as a society seem to be going more and more towards splitting and less towards having these complex mixed feelings, right? And this is a problem.
Can you talk about that for a moment in therapy as well? When splitting
as in splitting in therapy, yeah, sure.
Yeah.
I mean, there's many contexts. Rose, which do you have a specific example that you're wanting me to draw upon?
Not particularly. You, as you said about sorry, I have to get rid of my phone call.
It's all right. Do you need to get it?
No, I got rid of it.
Okay. Well, I mean, our patients, or people in general, we split all the time because it's too painful.
It's too painful to go there, isn't it? Yeah.
It's too painful to have two emotions at once. It's much more, it's less anxiety provoking if all I have is hate or all I have is love, right? I can either love you completely and therefore I have no bad feelings, so I idealize you. And that's a safer place than to allow myself to have both love and moments of frustration or anger, right? For some people, given what they've been through, that's a very anxiety-provoking situation. So instead, what people do is they split. It's either good or bad, black or white, love or hate. And so classically in therapy, where you see it most obvious is in people with relational issues, where they will idealize and devalue. So people will idealize someone and then they'll devalue another person. But to be honest, you see it in society all the time. We idealize various things and we devalue other things. And we end up going into groups and splitting off into different groups and subsections. And all of this is as a result of us not being able to handle both mixed feelings, both love and anger. together. And that, again, goes back to what if we were never shushed.
Exactly. I love it how we always go back to that earlier moment when we were told to calm down, it'll be okay, stop your crying, or I'll give you something to cry for.
Yeah, be a man. Be a man.
Man up.
You know,
Yes.
you know, recently there was a back to an old British saying of keep calm, carry on. You know, right. Stiff upper lip. You know, these messages, you know, people talk about them, they don't realize actually what they mean. They mean is keep going, act as though nothing's happened, you'll be okay. And that is the absolute opposite of what we should be doing as a human, as human beings. We have been given this intelligence, these emotions, this intelligence for a reason. And if we don't pay homage and honor them, then we're missing a trick here. You know, we're missing something very important.
You're making it look so much fun to go there. And I can't wait to get off the show and go to my emotions. Could you please, this is the take-home tool, this is the take-home insights portion of the show. Share with us and our listeners, and then I'm gonna, you know, show this on our YouTube and send it to Michael Galinsky's Facebook page. It's just a fascinating topic, and he actually turned me on and rose on to the change triangle, and Hillary Jacobs talks one of her tips for helping you with anxiety, and now I'm understanding it, is she goes, separate the emotions. You're upset, you're having anxiety. Put pain, put anger here, put guilt here, put fear here. She goes, separate them to help you with, you know, with anxiety, like even a panic attack. And I was like, I'm not sure I really understand that, but now I'm understanding what you're saying. Most important is how this is all intellectual. I know we have to get to our intellectually, but Rose taught me about the path from the head to the heart. So tell us from your point of view, maybe there's an example of a client you might have, no names mentioned, that you can, how so many of us, we get stuck there. It's scary, it's black and it's dark and we don't want to go there. We go there and we come back, but that's the place we need to live. We need to have an awareness of that place where it's automatic. Oh, there's my heart. There's my heart. Oh, there's my feelings. Oh, I'm welcome. Come in. Join me. How would you suggest that we get there a little bit more easily, a little bit more less painful, and to go there and get rid of the pain? I mean, like, you know, the pain will cease to exist, as Sarno will say. The pain will cease to exist. Go there.
Well, thank you for that, Toba. I think I'm glad in a way that you think that, you know, you're somewhat excited to look for the emotions, because I think the reality is that you know, it is the one thing that we are all reluctant to do because we have been brought up to not do that precise thing, and so there is anxiety. It's like, you know, that, you know, we call it really affect phobia. That, you know, I often use the metaphor of exposure. You know, like, you know, everybody in a way is afraid on some level of their emotion. You know, there is an anxiety about us having emotion. And so in a way, naturally, people often don't think it's fun to spend time with their emotion, because this is the very thing that they're trying to avoid. And they're not doing it consciously often, they're doing it at such a procedural level that it's just something that happens almost automatically. So it's actually extremely hard to give like tips as to how do you do this without going through very difficult therapy. I will, but it's very difficult to do this. And just to give an example of,
can you simplify the complicated?
To give an example of how, that's right. But to give an example of how hard it is to feel your emotions, I want to quote Bowlby, and then I'm going to quote another person, T.E. Lawrence, because I think they encapsulate really well.
Tell the audience who Bowlby is, please.
Yeah, so Bowlby is the father of attachment theory. So he's the one that really, and he has an interesting history himself, because he was a British guy from the upper class who was sent off to boarding school from a very young age. His father and mother wanted very little to do with him. He had maids that looked after him his whole life, and he never had a relationship with his mother at all. and you know, his maids just exited his life, and even though they were like his mothers, just like that, when they decided to fire them, and he went off to a British boarding school and never really had a close relationship with his mother. And so it's amazing when you think about it. Trauma, as we were talking about before this started, trauma creates creativity. Trauma can cause, you know, what makes change in this world almost. And anyway, as a consequence of his experience, he spent his life working in attachment theories, and that's amazing to me. But anyway, when he was talking about grief and mourning, he said this. He said, only if he can tolerate the pining, the more or less conscious searching, the seemingly endless examination of how and why the loss occurred, and the anger at anyone who might have been responsible, not sparing even the dead person, can he gradually come to recognize and accept that the loss is in truth permanent and that his life must be shaped anew. Right? And I think that quote encapsulates perfectly why we don't want to look at our emotions. Because we've all been hurt, we've all been traumatized, we've all lost, big or small, something in our lives at some point. And therefore we don't want to look at this pain. And I will go on to answer your point, Tova, but also I want to do another quote, which is by a writer called...
Important. This is, you said, please quote it again, because you said it very fast.
You want me to read it again?
Please quote
Sorry,
it again,
okay.
Yeah.
So he said, so talking about grief and mourning, he said, only if he can tolerate the pining, the more or less conscious searching, the seemingly endless examination of how and why the loss occurred, and the anger at anyone who might have been responsible, not even sparing the dead person, can he come gradually to recognize and accept that the loss is in truth permanent and that his life must be shaped anew, right? And he's really giving a beautiful example of how utterly painful it is to face one's loss and to move through, right? In our culture, we move around emotion, right? We move around it. Oof, it's like a spider that we don't want to touch. Our job as therapists is to help our patients move through their emotion. And we can't get them there unless they get to the other side. There is no healing unless you go through the emotion, right? But they've developed, you know, an understandable reaction to feeling their emotion. And John Fredrickson, he said, all those who seek healing had to bear pain that they couldn't bear by themselves, right? And so, and that's a very insightful comment, because what he's saying is that you can't do this alone. You need to do this with another. You had an experience where your pain could not be tolerated. You're not going to heal this on your own. You need to heal it with somebody else in witness to it. Somebody else who can heal in love what was damaged in love, right? And that's our job as a therapist. It's not easy to kind of, you know, put across how you would do this simply. I will try. But again, I just want to raise the point of how difficult this actually is and how much work is involved.
Yeah.
I want to do.
If we were to simplify the complicated, ultimately, can we say, even though it's not easy, if I can accept the reality of my pain, my suffering, if I can accept it and not fight it, and just accept it, embrace it, love it. I mean, love my fibromyalgia, love my cancer. This is what some of the people who healed cancer are saying. I had to love the part of me that fought myself and created damage in my, I mean, can we safely keep saying that? Because that's what, you know, it's like an acceptance, the true acceptance. Being honest with oneself, because I can say, well, I accept it, but I'm not being honest, so I'm not healing. Like true acceptance and recognition, Rose would teach me, or observing or witnessing that part of me that's suffering. Can you elaborate on that as you're simplifying the complicated?
I think I changed the word slightly to can we be curious about as the first step. Can we be curious about? Right, this is the important thing, is that before we get to acceptance, before we get to any of those words, we have to go through a journey to get there. You can't get to acceptance or forgiveness or anything like that unless you go through all of the stages of emotions you need to go to get to the other side. And so the first thing we need to do is be curious. And to be curious, we need to go, what is our body doing? Now, as I said before, our emotions are intelligent, right? Not only do they come up, and they're called feelings for a reason, because we feel them. If we don't have an awareness of our body or how our emotions show in our body, we are not going to be guided by them. We're not going to create a relationship with them, and we're not going to listen to the intelligence they have to offer us, and they're not going to guide our behavior. And so the first thing we need to do is be curious about what is happening in our body. And the best way to do this, if you're talking about not just in therapy, is through mindfulness meditation. Right? You have to be with yourself. You have to be curious. You have to open up a space in daily practice every day, continuously, to be able to bring your focus to your body and be mindful of your emotions and be mindful of what's your body doing and where are you feeling it. Are you feeling anxious? And what's the emotion underneath that's causing you anxious? And also be aware of what is the physical manifestation of emotion. Believe it or not, most of us feel our emotions in very similar ways, right? There are ways in which we feel joy. There are ways in which we feel love. There are ways in which we feel anger. There are ways in which we feel guilt, right? There's ways in which we feel sexual desire. They are all quite similar feelings. And we need to become very aware of them so we can be curious about them and begin to have a relationship with them. And we can do that ourselves, especially when we're going through some form of stress, and take a moment just to be curious, not to do anything, but be curious about like, what's going on, what do I notice? And the more and more we bring our attention to our body and what's going on in our body, the more and more we're going to be able to gain mastery, right? And expose ourselves slowly and slowly to this feeling, which originally we responded to with anxiety and destruction.
Could I add
whatever
gently?
form.
Could I add gently as well?
Yeah, absolutely.
Yeah. Gently see what's happening in your body in a gentle, maternal sort of way.
Yeah, absolutely.
See what's happening within you. Yeah.
Absolutely.
Wow.
Absolutely. And so that's the first step, right? That's the first step, which is bringing curiosity and awareness and training your mind, training you to be attentive to what's happening in your body. A lot of these people that we see, a lot of people who struggle, have learned to dismiss their anxiety. They've learned to try and get rid of it as quickly as possible, right? To not sit with it, right? And so I'll often say is like, what kind of therapist would I be if I didn't listen to your anxiety? You know, what kind of therapist would I be if I didn't listen to the signals your body is telling me right now, right? I want you to have an experience that you never had. You had people who dismissed your anxiety, but your anxiety is a signal. Something's coming up here that we need to look at, we need to pay attention to. And often, you know, that will take us straight to emotion.
Yeah. Well, of course it does, doesn't it?
Yeah.
I mean, it's all a mechanism, isn't it, to save you from actually feeling that emotion. And look, that leads me to another question, David. And that is that when we've got anxiety, we actually have anxiety that we can act on because it's an important part of our lives. And yet somehow with pain and suffering, it seems that the anxiety is going to that rather than an external threat, which we can manage.
Yeah. Right.
Internal threat that's going on in us.
Yes, exactly. Yeah. So they say that, and I'm not sure if I 100% am on board with this, but they, you know, fear is from an external threat, anxiety is from an internal threat, right? So fear is an external threat. Fear is something that, you know, comes along externally and can hurt us or impact on us, and then we have this fear reaction which helps us get away or do whatever, fight or whatever we do. But anxiety is actually an internal threat. So it's an emotion that's coming up within us that then creates anxiety, which then we need to do something about. And so these are two different things. And the way in which we think about anxiety is often external threat, but actually it's an internal threat. We have an emotion in reaction to a relational thing that causes anxiety in us. And it's the emotion that's coming up that causes the anxiety. And so that's why I'm saying we've got to pay attention to the body pay attention to what we're anxious about. And then we will find that beneath the anxiety is the emotion that is causing us to have anxiety and then develop these
And
symptoms.
I want to say, and I think Kayleen is on our show. She's living in Australia. And I believe her book is Love of Self. But she wrote a wonderful book, and it's about loving yourself, because a number of people, including me, and I'm here tearing up a little bit, because I might be impatient with myself. So you just explained a beautiful process of simplifying the complicated, and that I might be like, well, it's not working. So can I add on that enormous patience with oneself? Because we have people that come to us and they'll be like, well, I healed my pain. Why isn't it happening a second time? And so there's the ego. I did it. Why can't I do it now? Like, wait, you're not the same person. Like, you're not being loving. You're not being accepting. You're not being curious, but to be patient and do it again and again and learn this, this through the mindfulness and through the painful journey to look. It's not as easy as saying, I'd like you to have a habit of being mindful, but we are all learning a habit of being mindful, because that's it can be that way. We learn a behavior, we learn an action, a belief that we're worth it. We're worthy of and the healing yourself. You have to heal. Of course, you're ultimately doing it yourself. Thank God with a therapist, but the patience people need for themselves.
Yeah, that's right. Yeah, but also there's
right, Rose.
Well, I'm thinking that the shame stops that happening. David was speaking about before. It's the shame that stops the acceptance, and if we go to guilt and make restitution or reparation with ourselves and our own souls, even if we can't do anything about how we hurt ourselves or others, we can actually be aware of it. Instead of turning to shame, if we turn to that awareness about our guilt, for example, we can then not have that sense of I'm shutting everything down. So
I would
don't know that I've answered the question, but
no, but I'd add to that I think you're completely right over the patience. And who would be patient when you're suffering so much? Who would be patient when you've got pain in your heart? Who would be patient if you've got pain in your body? And the thing, and this isn't maybe going to be comforting, but in a way it is comforting, is like it would be totally dishonorable to the people who have suffered to think that we could heal their psychic wounds quickly.
Exactly.
Like it's totally, again, and we go back to this medicalization of misery. Yeah. It is totally dishonoring what they have been through, right? They are not a medical problem. They are not ill. They are healthy human beings who have been put in an unhealthy situation, and they're reacting as healthy human beings to an unhealthy situation. And this is the problem, right? And this is what gets me really frustrated. I'll often speak to my clients who have been diagnosed with borderline personality disorder or something, which has a really bad stigma. And I will say to them, you are healthy. What you're doing and how you're living your life may not be healthy, but if we think about the trauma, neglect, abuse you have suffered, if any human being suffered what you suffered and they didn't have relational issues, I would think they are insane. But the very fact that you are reacting as a human being to an inhumane situation, this is the consequence of being human. Right? There's nothing wrong with you, right? Doesn't mean I can't help you, doesn't mean you need to get help. It just means that you are a human being who is reacting as human beings would to an unhealthy situation. And there's so many of us like that, all of us are like that. This is what human beings do. And so when you say patience, you're absolutely right. But one of the reasons why we're impatient is because we don't have a good understanding, or we don't have compassion to ourselves and what we've been through.
Yeah.
And therefore that's going to take time to heal. And we also, we have lots of pills that we could take that will help. But again, this is avoiding and tranquilizing or pushing down the feelings that we need to feel in order to get healthy.
Yeah. It's honoring, isn't it? That person.
It's so honoring, right? It's so honoring. And when we're rushing, And of course you want to rush, and of course you want to get well quickly. Like, I totally get that. But if we believe that we can do that quickly, we're really dishonoring what that person went through in their life.
Yeah. And, you know, adding to that, I often say to patients, look, you know, they say, I've been seeing you for 6 visits. And I say, well, that's 6 hours. That's not even a working day that you've spent with me. And you want to change 40 years of suffering? It's pretty cool. Tell me how we do that.
Yeah, right, exactly. And I have, you know, I think all therapists will experience something similar to that. And again, I will talk to them about, it seems really unkind to you that you feel that this is something, your trauma, your pain, your suffering can be healed in such a short space of time. And I'm very upfront with people. I just talk, this is going to take time. I'm sorry it's going to take time, but it is going to take time. And it's compassionate to you to understand that more.
Well, you see, it's not about taking time, because if you think about 6 visits over 6 weeks, for example,
that's nothing.
It's only 6 hours.
That's terrible. That's nothing. Yeah.
How are you going to change anything in 6 hours?
No, you're not.
It's not even a working day.
But we're back to that if there's a healthy relationship between the client and the therapist, and the person feels curious and hopeful, they can participate in a way to create a very healthy journey, like an active journey where daily they can see changes. Or we'll have clients that'll have a great couple of days and then a not a good couple of days, and it's like, and they're down again. I'm like, wait a minute, look at those days that you were, it's like, and one of the, Alan Gordon is a social worker that writes a lot about, healing pain. And he says, don't even label your days good or bad. They're days.
Yeah, okay.
But as the patient, as the client participates in their healing, I think it can happen efficiently, differently. And there could be lots of hope around us that tells us we're on the right path. Rose, you're going to say something.
Yes, I was going to come back to David's original comment about being shushed. How can you feel unshushed with a therapist when you anticipate you're going to be shushed?
Good point.
So therefore, it is an up and down, because you have to have moments that you realize you're not being shushed, and that this scenario you've got with your therapist is not like your old scenarios, because this person is actually in there with you.
Brilliant, Rose. Brilliant.
Yeah, exactly. And I think it is frustrating if you are in suffering. Of course, you want to be healed as quickly as possible, but again, it is so important to respect what has been before and what has come before, and pay homage to that, and realize that it's going to take time to move through and work through all of the pain and suffering. But you're right, it all happens in a relationship, and the relationship itself is the healing part, right?
It is.
What was damaged in love must be healed in love. And so what was, everyone's coming to us from a relationship that was dangerous or caused them some suffering or not. Our relationship in therapy is creating a relationship which is going to do the opposite. We're going to heal in love what was damaged in love. And what David Milan said, what went wrong must go right. Right? And that's what therapy is. What went wrong must go right. It's a simple way of saying it. And that's not going to take 6 hours. That's not going to be 6 sessions of therapy. That's going to be a long period of time. And so, often people will say, well, give me like these skills and strategies. Give me skills. Give me the thing. Give me the skills and strategies.
Tell me what to do. I want to do.
Give me the skills and strategies. And I'm like, I wish I could give you the skills and strategy. I say, Google is fantastic at that. Just type in skills and strategy. They can give it to you. What I can give you is a relationship.
Oh, that's right.
It's so beautiful.
But that's, how are we going to heal people unless we give them a relationship? We cannot heal anyone unless, I often say to people, not clients, but I'll say to people, in order for us to really heal someone, we need to give them an experience that was as powerful, if not more powerful than the trauma they suffered.
More powerful, yes.
More power than the trauma. And how do we do that? It's just me and another person. I've got no gadgets. I've got no tools. I've got nothing. All I've got to offer is my presence, my attachment, my relationship, right? That's all I have. And that, if you think about it, of course that's going to be healing, but it needs time. It needs time. You can't do that quickly. Because as David Milan said, what went wrong must go right. That is the therapy.
Tova, would you on the side please put Edtronics?
Oh yes, I wanted to mention that in the beginning because it shows. You know about the Edtronic still face?
No, what's that?
You do, David.
Well, I can't hear. It's kind of went a little bit.
Okay. Well, still face experiment.
Oh, okay. Yeah. So okay.
Yeah.
Yeah. So the sound.
I have it up on I have it up on the page. I'll repost it today.
Yeah, repost it because what happens is it allows people who are watching to actually see that again and see how they react when they're not being listened to or when they're being
right. Exactly. Right.
So it goes back. Like that's what I love about just setting this little program up, because we're actually looking at how we are shushed in the most loving and kind way, maybe, but it just blocks our feelings and our emotions, and then we have to do all these activities to draw our carer back to us. And it's only about 3 minutes or something, but it's so telling. And
right, exactly. Exactly.
And it often brings up tears of sadness and grief for people, and then they're able to start their journey when they see that, and they understand that this is where their journey needs to lead them to repair that. Yeah.
You know, it's as simple as that. When you're with a patient and they're not looking at you for a whole 60 minutes. They just don't look at you. You think as a therapist, you think, oh, that's really interesting. Why don't they look at me? But they didn't look at you because if they looked at you, it would cause emotion, it would cause attachment, it would cause something that was too anxiety provoking for them to experience. And that's just a tiny, tiny example. The other example is you're speaking about something painful and your client is laughing. And you're thinking, wow, but this is so painful. Why are you laughing? And yet these are the small signs, these are the small signals that we pick up as therapists that tell us, oh, it's really difficult for you to be with me, in relationship with me, and be honest about your feelings, not because of me, but because this is innate. Well, not innate, actually. This is something you've learned as a consequence of what you experience. And so it's through those little moments in therapy when you're creating a relationship that you create a relationship for change, right? And again, so this is not something that can be done in a succession, as Rose was saying. This is something that needs to develop as a relationship would, right? And we're not starting from zero. We're starting from whatever age they are. So it takes time.
Wow.
David, thank you so much. It's just been such a lovely, lovely chat. And everyone on the side here has loved your explanation.
Yeah.
Oh, that's good.
Kayleen saying how she was told to stop crying.
So well, wonderful. Glad to have the conversation. Always up for a conversation. It's fascinating. Lovely to speak to both of you.
And I have hope for the future. I have hope for the future. I mean, my daughter is 22 and she's saying, Mom, I need to cry. It's going to help me get my emotions out. So please just listen to me. Don't fix me. And I'm like, she's telling me I shushed her when she was little, that please don't shush her now. And I raised her to express what she needs. And so we're healing. The next generation, please God, will heal from our wounds. They'll have their own wounds that they'll be able to heal, because there are, wonderful people like you and I and all these people in the world that are able to, accept our human. Like Michael Galinsky will say, we're just, humans in this body having this human experience. And so the beautiful point that we can say goodbye on is about, really knowing ourselves, accepting ourselves. And I'm grateful for meeting Rose. She teaches me so much about some of this work. It's fascinating. And I'm just, you've really made it so simple Thank you so much for making it so simple, Rose.
It's not so simple, Tova. It's
I know,
but
you know, it can come to a place. No, it's not so simple, but it can come to a place in our monkey brain that could be, I get it. I internalized it. I feel, I feel the ability, that the hope. You gave me hope for our clients, for my life, for the world, for, you know, you gave me hope, and you gave people on the show hope. And I'm excited about the energy of hope spreading through the waves of the world, you in Melbourne, me in Israel. And I really am happy to meet you.
That's wonderful. That's wonderful.
Yeah. Well, good night from Melbourne. And thank you again, David.
It's been a pleasure. Absolute pleasure. Absolute pleasure. Good night.
Okay,
Tova Shalom.
Ken.
And I will we'll keep in touch. But thank you
Right.
very much. Thanks for everyone who listened.
Thanks, David.
God bless. God bless.
Yeah.